So I'm going to tell a tale of a history of medical gaslighting that we're maybe hopefully coming to the end of right now. And this goes back to 2000 with the Women's Health Initiative. Came out, oh my gosh, hormones cause breast cancer, cause strokes, cause a lot of bad things. And almost overnight, women were stopping their bioidentical hormones. We were being told, stop taking them, they're killing you, et cetera, et cetera. And within a period of maybe 2 weeks, it made it the news, it was on mainstream, The thing was, about a week or two later, physicians and other practitioners started looking at the data and saying, wait a second, these were females in Canada who were smoking and weren't the healthiest, and they're using oral Primpro, which we know is horrible for you, oral estrogens, because the metabolites are really bad. We won't go into that. But that news never got out there. And the result was almost 25 years of women go through menopause, perimenopause. What is the best treatment for osteoporosis or prevention? It's actually bioidentical hormones. When women go through that change of life and they start developing autoimmune issues, chronic fatigue, they start developing muscle aches, brain fog. I'm actually on a trip. My wife and I are on a trip, and we have a lot of women in that age range. And just funny to listen to how many people are suffering in the 40s, 50s range with a lot of hormonal issues, toxicity issues around hormones. So go forward from 2001 to 2015. If you were to give a female hormones during that point in time, it was a medical legal risk. And so you have to sign special consents. And most physicians just stopped doing it in general. Now, I feel like we're returning an inflection point where now more endocrinologists, more GYNs are getting comfortable with bioidentical hormones going back to that, because now we have data coming out that if you're on bioidentical hormones and you're diagnosed with breast cancer, it's less aggressive. Bioidentical hormones, or actually going through menopause earlier, are associated with high risk for dementia, high risk for autoimmune issues. A lot of stuff is coming out now that actually have bioidentical hormones, taking them actually can help preserve brain volume, hippocampal volume, memory, cognition, help preserve muscle mass, which is one of the biggest predictors of whether you survive hospitalization as you get older. So all of a sudden now we're realizing, hey, wait a second, maybe these bioidentical hormones are actually good. And the data is actually becoming clear that it's actually synthetic equine, which is basically horse urine, Primpro stuff. That's the bad stuff. Medroxyprogesterone, which is a synthetic progesterone. That's what's associated with cancers and tumors. That's bad for you. So it actually isn't the biosimilar, i.e. bioidentical hormones that what look like in your body. It's just making the synthetic stuff and then dosing them really high doses, 3, 4, 5, 6 times higher than you typically get. Dosing it by mouth, well, of course you shouldn't be dosing. And then not checking levels. Like, have you ever had, if you're taking thyroid medication, does anybody check your thyroid levels? Of course they do. If you're taking diabetes medications, do you check, A1C levels, glucose levels? Of course you do. And so this concept of giving women estrogen, progesterone, testosterone, even when we give men testosterone, when men started getting testosterone shots, T shots, they were actually getting the levels checked. So we're just now turning the corner of, hey, wait a second, this is a thing, it should be treated, and levels should be checked. But I feel like that's an example of how our healthcare system got things wrong for, quite some time, and we're just now starting to turn the corner on. The question is, how many other things are like that in a healthcare system? And if you just watch the history of it, it's a history of missing blind spots. For those of you who aren't quite following this, don't quite get this, a great book by Marty McCary, Blind Spots. He also wrote a great book about healthcare, the price we pay, and talked about why some of the stuff we do in healthcare is the way it is. It's because of the economics of things. Those are two great reads that are actually on our reading list on our website, and I've discussed a lot that could help you kind of wrap your brain around why things are kind of crazy the way they are. But the concept of medical gaslighting, we're maybe working through bioidentical hormones a little bit. We're still dealing, if you're particularly women who have complex health issues, if they don't fit in boxes, usually they're blown off as having psychiatric issues. Nothing's wrong with them all in their head. And unfortunately, we deal with that all the time. We need to stop it. It needs to be done. So if you have your own story you'd like to share, please put it below. I mean, any comments, I'd like to hear them. I feel like the only way for this kind of news to get out there, for people to start realizing, hey, we need, listen to all patients. I was always taught in my training, when I was younger, that, the patients will eventually declare themselves. If you can't quite figure it out, just listen to the patient. And eventually, over time, they'll tell you what's going on. I feel like we've lost that with all the technology, with all the fancy testing we've done, we're doing now. We've kind of lost the medical curiosity to actually dig deep and try to find out what's going on with people. So the only way to get back to that, I believe, is just to share stories, to talk about it, and then for people to hear, like, hey, maybe that's me. Maybe I should dig deeper. Maybe I should find a different practitioner. Or the reality is, in today's world of AI, I'm actually encouraging people to do this now, is you can take now tools, create your own health AI, plug your labs in there, plug data in there, ask their questions. And actually, unfortunately, it's kind of crazy how you actually get some decent responses back. And it's sad that as a medical doctor, I'm recommending this to patients. I'm not recommending this. This is not medical advice. That's right. I'm not giving you medical advice. I'm giving you opinion because I can't give you medical advice because that's frowned upon by medical organizations. But you get the point. Like, you really need to be proactive and kind of take charge of your own health. Because if you don't advocate for yourself, it's unfortunate that you might be on your own. Hopefully you'll find a good practitioner to work with you, a good functional practitioner that'll listen to you. Anybody that'll just listen to you and help walk alongside. That's how I got here, is just listening to patients, listening to their complicated stories, and then coming alongside them and helping them with their journey. So hopefully this information is helpful. Please, love to hear your stories. It also gives me some information that, if you have something like a little walking talk you'd like to hear about, please drop below and I'd love to talk about. Want to hear more about. We also have our podcast and a bunch of educational resources to help you get the information, take charge of your health here. Take care and we'll talk to you soon.